When you phone a GP and it says your conversation will be recorded for training purposes, what do you do if you don't want it to be recorded or don't have the confidence you say you don't want it recorded? And the same question if you are asked if you mind having a trainee in or on your appointment.
The answer is we have to record the calls in case there's an issue. So the reason we record them is so supposing someone came back to us later on and said, actually you said something that maybe didn't make sense or was confusing, or if we gave the wrong advice, we need to be able to know about it. So it's very rare, but we occasionally listen back to calls. The answer to your question is, if you don't want to be recorded, I'm afraid there isn't a way of being able to stop it. So it would mean coming into the surgery and asking the question there. But I believe we can have these recordings deleted, but they're not usually listened to. So in terms of that, and certainly they wouldn't be shared outside of the surgery. Does that reassure you? Yeah. In terms of trainees, we all have to learn, and so often I have younger doctors or sometimes nurses or other healthcare professionals sitting in with me, and we always take the view that if you don't want someone else sitting in, it's really important that you say. So I always ask before, if I've got a student sitting in with me, for instance, I always say, is it alright for them to sit in? And if at any point you want them to leave the room, then you can say so. Because I think it's crucial that people feel that they can talk, and sometimes if it's something that's quite personal or quite difficult, it can be easier to talk one-on-one. But having said that, those are the really important things to learn about. I only got to be a doctor because I sat and watched doctors consulting and learned how they did it, and that's how you learn. So we really value having trainees around, and sometimes it actually brings a lot to the consultation because you've got another voice there, and sometimes my best ones are the ones where I've got a student and they start asking questions as well, and that gets really interesting.
Yeah, that's happened to me before when I go to the doctor, they ask questions as well.
Yeah, okay. And I really like it when it's much more interactive like that, so I think it's really helpful.
Some people say they have to wait quite a long time on the phone to make an appointment for the GP surgery. What do you think about having two phone lines for urgent and non-urgent inquiries?
Different surgeries have tried different ways of doing this, and what's really hard is that sometimes people aren't very good at recognising what's urgent. So I certainly know of someone who had pain in the middle of their chest that had been going on for a couple of hours, and he didn't want to trouble us, and he left it a couple of hours, and he was having a heart attack. And so we need to know about those things early, so we try and make sure we deal with things as we try and deal with everything as though it's urgent, really, and some of those things aren't, but it gets really hard to work out what's urgent and what's not, so it's trying to make it as simple as possible. So we try and keep to one phone line, really, but I really like the idea. Had you any thoughts of what would be helpful? I suppose that would be a good question.
Some people just have a bug, but if it's just a little bug, it could not be so effective as if you had the flu or a heart attack, like you said.
Yeah, that's really true. It's part of the trouble is that people don't necessarily know how serious things are, and so a lot of the questions we get, they're saying they might not know whether it's flu or a cold or something else. They come in and say, I've got a cough, or I'm finding it difficult to breathe. There's good advice about, if it's life-threatening, to ring 999, and anything else comes through the surgery, but we try and be really quick at answering all the calls, and you'll notice that when you ring a GP surgery now, the receptionist takes a bit more information about your medical condition, so we can identify if it's urgent. They're trained, so if someone says, I've got chest pain, they have a particular script that they follow to say, how long's it been there, is it going away, and then that comes through to us really urgently. So we do try and make sure that we filter these things out, and someone who rings up for a prescription, then we can say that's not quite as urgent. So we do try and what's called triage it, so we try and work out how important things are, and we get our doctors to answer the important ones as quick as we can.
It's those information sheets.
Okay.
If you wanted to know what a bug is, it would ask, is it red? And it will go to bug. and then it would say this is a red beetle or something.
Oh yeah. I know the ones you mean. Yeah. We tried doing that, and there are with artificial intelligence. There will be newer ways of doing this. At the moment, they're not very good, and I don't think I'm going to be replaced by a computer anytime soon. But certainly, people are trying that because we don't have enough doctors, and they're trying to find other ways of managing it. It's a really good question.
What age do you have to be to go to the GP on your own, and do your parents need to be informed, or is it confidential?
There's no minimum age, although it would be really unusual for a primary school child to be seen on their own. It's happened once or twice to me, but very, very rarely. If you want to be seen on your own, it's fine to ask for that. But I always think, often if I'm seeing a school-age child, I'm aware of the fact there's a parent or carer outside who really needs to know what's happening. Now, I can't say anything about what we've discussed without the patient's permission. So what I usually say at the end of it is, I think the person with you would like to know what we've talked about. Is that okay by you? And then I would call, say, parents or carer in and say, these are the things that we've talked about. These are the things that I think will be useful to do, because I know that's reassuring for them. But I always make sure that it's in front of the patient so that they kind of know what we've discussed and that they're happy with that, because we're really, really strict about confidentiality. We really want to make sure that you feel able to talk about things, and sometimes it can be hard to talk about those things. One of the really important things is having someone that you trust, often outside of the family, because sometimes there are things that are difficult to talk to even your parents about. So it might be an aunt or a neighbour or a teacher that you trust, and that's really useful to have the ability just to go and run it past someone else that you trust. So I always suggest to have an adult that you trust just in the background. So if there's an issue, that you've got someone that you can't tell anyone else about, that you've got that ability to do it.
Thank you.
What are the rules about having same-sex professionals in the room for situations such as physical examinations?
This is a thing we call chaperoning. So if we're doing an examination of the body, we would usually try and make sure there's someone else. So as a male doctor, if I'm examining a female, I would always ask a nurse to come through and to be in the room with me, because then everyone feels a bit more comfortable that there's someone else there. If I'm seeing someone of the same gender as me, it's less of an issue, but we always offer what's called a chaperone, someone to be present, if it's particularly an intimate examination, if it's an area of the body that's got private with.
What is your opinion on hospital food, and how healthy is it?
It's been a long time since I've been in the hospital, although we cover the local community hospital. Sometimes it doesn't look as healthy as you'd like it to be, but we have to cater for people with all sorts of different dietary wishes, and sometimes having kind of reassuring food is there. The thing that bothers me most is the unhealthy snacks that are often in the foyers of hospitals. They're often chocolate bars and crisps and things like that, which I think don't give the right message. So it's often the food that's available to staff and to visitors isn't as healthy as we'd like it to be. But generally, hospital food's come a long way, and it's much better than it was. But no one really wants to be in hospital, everyone wants to be home, and there's nothing like being at home and having your own food.